Provincial government has warned residents that hospital emergency centres are under severe pressure. Doctors and nurses are seeing a sharp increase in COVID-19 admissions and increases in other trauma cases. To get more details on how medical professionals are coping during this second wave of COVID-19, we are joined via Skype by the head of the Western Cape Health Department, Dr. Keith Cloete. Dr. Keith, good morning and welcome to the agenda. Can you just give us an indication of what the pressures are currently like in the province?
Good morning, Aldrin. Good morning to the viewers. I can confirm that all the hospitals, private and public, are under severe pressure in the Western Cape, specifically in the Cape Metro, but also in the Worcester Hospital drainage area and the Paarl Hospital drainage area. The only place in the Western Cape where there is a lightening of the pressure is in the George Hospital drainage area, which is the Garden Route and Central Karoo. But everywhere else, there's significant pressures. As of yesterday, there were 3,000 people admitted in public and private hospitals for COVID confirmation cases, confirmed cases. About 1,700 in public hospitals and 1,300 in private hospitals. There were also 360 people in ICU or critical care for COVID, 80 in the public sector and 280 in the private sector. So there's all-around severe pressure on all the hospitals. It manifests itself in the emergency centers. And over the past weekend, we've seen big pressures in the emergency centers in the bigger hospitals in the Cape Metro, but also in Worcester and Paarl. And that's mainly been due that people are presenting with COVID disease. But at the same time, we've also seen a surge in alcohol-related trauma in all our big emergency centers across the province.
Okay, let's just quickly then speak about the COVID-19 related cases. Is there any clear indication as yet whether this 501V2 variant has had any contribution towards this quick upsurge of the cases that we are seeing in the province?
We definitely, because of the picture that we saw in Garden Route, when the announcement was made of this new variant, it explained the rapid increase in the Garden Route, and also explains to us the rapid increase we've seen in the Metro, and then also the other districts in the Western Cape. So from our experience, we definitely see many more cases than was the case in the first round. Although in the first wave we had lockdown and also alcohol restrictions, we definitely believe that the variant has got a big role to play in the surge in the cases currently in the Western Cape.
Do you know what the split is between what we just understand to be COVID-19 and COVID-19, this new variant?
What the scientists tried to share with us last week, and that's from the samples that they take. So everybody will just make an estimate of it. But what they've said, if they take the samples of the various variants, this specific variant is just spreading so much faster than the other variants. So at this point in time, the only thing we have to go by is a sample taken on the Cape Flats at a facility where of all the samples that were genocoded in that specific facility, 88% of the cases that were genotyped was from this specific variant. But that's all we can go on. And anything from there would be an extrapolation and assumption in terms of the broader case numbers across the province.
And then in terms of its contribution then to the mortality rate?
The mortality rate, as we understand, this virus, this variant is more infectious. So it spreads more easily than the previous variants. But there is no evidence to suggest that it is more virulent or more pathogenic, which means that it causes a more severe form of disease. It just causes more cases, but there's no evidence to suggest that it causes more severe disease. Therefore, the pattern we're seeing in terms of mortality, the pattern we're seeing in terms of hospitalization is still very much the same as with the previous variants.
And the symptoms that those patients who have this variant, what symptoms are they showing?
Very much the same kind of symptoms. Very little change really in terms of the presentation. So the only thing we do know, it is more infectious. So what it means is you need a smaller amount or dosage of the virus to become infected compared to the previous variants.
Does this then mean that there needs to be a different strategy to how we deal with COVID-19, considering that the tally that was done before, including which hospitals will be used, how many field hospitals would be needed, how many beds would be needed, that now needs to be revised?
The strategy remains the same. All it means is there's more cases in a shorter period of time. So all it means is your strategy is exactly the same. We need to wear masks, we need to social distance, we need to be very more stricter on gatherings because that's where it spreads. And our capacity to cope with it, we need still exactly the same capacity. It is just that you have to deal with much bigger numbers of cases in a shorter period of time.
Mm-hmm. And then the capacity, do you think that the province has the capacity?
We have brought online additional intermediate care capacity both in the metro and across the other drainage areas in the province. In Garden Route, we have just about coped by de-escalating in our acute hospital. So you need to understand, when the cases increase like this, one of the big things that happen is that healthcare workers also become infected. So your ability to bring additional healthcare workers is severely constrained. So our strategy has been overarchingly about de-escalating everything other than COVID in our hospitals to be able to make space for COVID. Mm-hmm. So the de-escalation of other things out of acute hospital beds to allow for COVID in the acute hospitals is the biggest strategy. We brought on additional capacity, field hospital capacity, to the tune of 613 beds in the metro. The rate limiting step for that would be to get sufficient staffing to be able to cope with that. So we are actually bringing, as we speak, over the last couple of days, we've employed 47 additional people. There's another 400 that we potentially can employ over the next couple of days. And there will be another 400 to 800 that we can employ over the next 2 weeks. So we are doing everything in our power to bring additional staff in. But at the same time, we have 880 staff members that are actively positive as we speak.
Do you believe, Dr. Cloete, that any other stricter regulation being put in place to try and curb the spread of the virus would be successful, considering that you have the South African Medical Association saying that let's move back up to level 2 and that will try and curb the spread of the virus, including deal with the issue around the sale of alcohol?
It has been our belief as the health department, and we've made it very clear in this province, that any restriction that firstly impacts on gatherings, the movement of people, and then also the availability of alcohol will have an impact on the healthcare platform to respond. So any restrictions that assist with decreasing the potential for spreading the virus, and then secondly, any restrictions that will assist to decrease alcohol-related trauma will be the ones that assist the healthcare system to cope with what's coming at them.
Mm-hmm. Have you made any submissions to your provincial head at all, just ahead of the President's announcement?
We've had a Western Cape internal discussion with the Premier and with everyone, and our submissions have been submitted internally in the Western Cape.
Can you share some of those with us?
I'm not at liberty to share that.
Okay, thank you so much.